Okay, to begin the procedure, I will gather my supplies, and I would have gloves normally, but I forgot to bring some home. I would gather my supplies, I would identify my patient, I would provide for privacy, I would introduce myself, and I would assess for any allergies to medication or cleaning solutions or latex. I'm going to perform hand hygiene and put on my fake gloves. Then I'm going to assess my injection site. For the deltoid site, you would go 3 finger widths below the acromion process and then 2 finger widths above the insertion site for the deltoid muscle. For that site, you use a 3 milliliter syringe. I have 2 milliliters of medication in here, and I have a 21 to 25, I have a 23 gauge needle that is 1.5 inches long. For the vastus lateralis site, you would do one hand below the hip and one hand above the knee on the outer upper third of the thigh. For that injection, you use a 21 to 25 gauge needle, which is 5/8 to 1 inch in length and 2 to 5 milliliters of injection. Or the ventrogluteal site, where you palm the greater trochanter of the hip, thumb pointing towards the umbilical region, pointer finger pointing towards the iliac crest, and middle finger towards the spine, and in the middle is where you inject. That site requires a 21 to 25 gauge needle, a 1.5 length of needle, and again a 2 to 5 milliliter of injections. And then we really try to avoid the dorsogluteal site because the sciatic nerve and really important blood vessels are so close. So because I'm doing the deltoid muscle, I have chosen a 3 milliliter, 23 gauge, 1.5 inch length syringe and needle. First, I have my gloves on, by the way, I think I said that. I'm going to clean the site, and then while I'm letting that dry, I'm going to uncap my needle, and then I'm going to pull the skin taut and go in at a 90-degree angle and use a darting motion. I'm going to support the needle. I'm going to aspirate a little bit and make sure that there's no blood return, and then I'm going to inject. I'm going to pull out, have a Band-Aid on it, release the safety, and put it in the sharps container. When I'm done, I will document the medication, like the drug that was given, the patient education given, the dose, the route, the location of the injection, and any reactions that took place. And then that is my skill.